so we're group 3, and we have compartments of the lower leg. I'm Aubrey, that's Maddie, and then Emily is behind the camera.
Hey.
Hey. Okay, so a short overview of our presentation. We're going to be talking about the anterior compartments, the lateral compartment, the deep posterior compartment, the superficial posterior compartment, and then also compartment syndrome. So on this picture, I'll point out the compartments for you. So this is going to be the anterior compartment. This is going to be the tibia, the fibula, the lateral compartment. This is going to be the superficial posterior compartment. And the last one, which is actually 2 compartments because it's split by arteries and veins, is going to be the deep posterior compartment. So some general information as well about the compartments and how they're split. There are borders of the compartments. It's the tibia, the fibula, the interosseous membrane, and the anterior intermuscular septum. Also, each compartment is surrounded by a fascial layer, and that does not expand. So looking at the first compartment is going to be the anterior compartment. That is comprised of the tibialis anterior, extensor hallucis longus, extensor digitorum longus, fibularis tertius, and then it also has a nerve, and that's going to be the deep fibular or the peroneal nerve, and then the anterior tibial artery as well. So going on to the next compartment, we're going to look at the lateral compartment. This is comprised of the fibularis longus, the fibularis brevis. This also has a nerve, and that's going to be the superficial fibular nerve, and then it also has the fibular artery. So our third compartment is going to be the superficial posterior compartment. That contains the gastrocnemius, the soleus, the plantaris. It also contains the tibial nerve and the posterior tibial artery. All right, so the last compartment is going to be the deep posterior compartment. That contains the tibialis posterior, the flexor hallucis longus, the flexor digitorum longus, the popliteus, and that also contains the tibial nerve and the posterior tibial artery.
So a problem with the lower leg compartments that can happen is compartment syndrome, and this is swelling or an increase in pressure in one of the lower leg compartments or more than one compartment. So this can compromise circulation and put pressure on the nerves, which can cause weakness and pain. So often compartment syndrome is caused by contusion, fracture of one of the bones in the lower legs, crash injury, localized infection, or even excessive exercise and overstretching. So because it compromises the blood supply and neural activity to the lower legs, it can cause tissue death and lack of oxygen, so ischemia. And one of the ways that you treat this is fasciotomy, which Maddie will talk about later. So there's 3 types of compartment syndrome: acute, subacute, and chronic. Acute is caused by bleeding in one of the compartments. So common causes of that are fracture, blunt trauma, reperfusion injury after acute arterial obstruction, and this increased pressure can cause nerve damage or tissue damage. So that can lead to ischemia or necrosis because of the lack of blood supply. Subacute is caused by a sudden and dramatic increase in the pressure of one of the compartments. So crushing trauma, burn injury, prolonged tight bandaging can cause it, or post-surgery this can happen as well. So this is a deep aching pain, and numbness and swelling and tightness is a way that this manifests. And then the third one is chronic, and this is caused by chronic overexertion, so excessive exercise. This manifests as pain when they're doing that strenuous exercise, muscle cramping, tightness, and then occasionally paresthesia. So this type of compartment syndrome doesn't respond to anti-inflammatories or physical therapy.
All right, so one of the procedures used to treat compartment syndrome is a fasciotomy, and this is generally performed for acute and subacute compartment syndrome. It involves making an incision in the fascia to relieve the pressure in that muscle compartment. This allows increased blood flow to the muscles, and it gives space for the nerves. If the swelling is too severe, the surgeon may use a skin graft, and that is a healthy piece of skin from another part of the body, just to cover that area and help it heal. This decreases the risk of recurrence by providing more space in that compartment. So in summary, we've talked about the general information about the compartments of the leg, as well as the contents of the lower leg compartments. Just a reminder, the compartments are anterior, lateral, superficial posterior, and deep posterior compartments. We also talked about what compartment syndrome is and how a fasciotomy can treat compartment syndrome.
All right, so for our model, we are going to show an anterior compartment and what would occur in a fasciotomy. So this is a regular leg. Pretend this is actually her anterior compartment. Generally, it's actually not going to be this round, or it's not going to have give to it. It's going to be harder. But we figured it's not a good idea to actually do a fasciotomy on a person. So we're just going to draw. So if her anterior compartment was swollen and needed to be relieved of pressure in an emergency situation, we would come down, and what we would do is we'd show 2 incisions on her anterior compartment to help relieve the pressure and stress. So we would cut here. It's not very straight. We'd also cut there, and what would happen is the skin would split open, and then, like I said, would relieve the pressure and create space for muscles and the nerves to expand. And that's our